Thanks for watching Afternoon Live. June is National Migraine and Headache Awareness Month. So joining us with everything you need to know, we welcome back chiropractor Chris Cooper. Thanks for being here.
Yeah, thanks for having me back.
You deal with this stuff a lot at work.
We do. This is kind of our clinic specialty,
Okay.
and so we see a lot of people with different types of headaches come in all the time.
Let's talk about just the basics of what are the big differences between a regular old headache and an actual migraine.
There's a lot of different types of headaches, actually.
Okay.
And so migraines can be classified as a really, really bad headache that has two of three things.
Okay.
Light sensitivity, sound sensitivity, and nausea. Pick two. If you got two, it's a migraine.
That sounds pretty awful.
Yeah, it is horrible.
I'm not somebody who gets migraines and I feel guilty about that.
Yeah, some people deal with migraines a lot. It's
Yeah.
a constant thing. There's a lot of different triggers for migraines, and sometimes it's avoiding triggers.
Okay.
Sometimes the trigger is hormones, and so you can't really avoid that sort of thing.
That's so tough.
But if it's an avoidable trigger like food or light or sound or whatever, you can avoid that sort of stuff.
Is food an actual common trigger for something like this to happen?
Very.
Okay.
Very. And I am so sorry to say this, but a big one is like red wine and cheese and chocolate.
Why did you just say all the best things in
I
a
know.
row?
I said I'm sorry.
That
I
was
said
so
I'm sorry.
mean.
I
That was
apologized before I
so-
said it.
Nope. Okay.
I know.
Okay.
I know.
Can't say you didn't warn us.
It's just I didn't make the rules. I didn't.
That's a bummer though.
Yeah.
So you've got to acknowledge
Yes.
that these things are giving you a hard
so
time.
it's not a trigger for everyone, but if
Sure.
it is your trigger, that is the thing. And so you make those choices like, well, it's worth it,
Oh no.
have
Oh,
that
no.
glass of red
That's
wine.
tomorrow me's problem. What about something that we think about like more in a headache context, like just stress? I mean,
Yeah.
does that contribite to both of those things
100%.
happening?
100%. Probably one of the most common types of headaches I see is called a tension type headache.
Okay.
Where a typical one will radiate up over your head, land behind your eyebrow or
Yeah.
your ear, and it's kind of like one-sided, throbby, grippy, vice grip sort of pain. That is commonly dealt with like stress causes it, which can be like shoulders up around the ears
Sure.
sort of thing, neck muscles. This is where chiropractors have, or even physical therapists or massage therapists have a good track record of helping because it's getting the muscles to relax, getting the joints to move normal, and sometimes that can take away a trigger for a tension headache.
So are there other triggers? We talked about food. We talked about some light sensitivities. Are there other common triggers that people should be aware of?
Those are the big ones.
Okay.
Those are the big ones. If you're probably having a tension headache if it's not light and sound sensitive.
Okay.
And so, focus on posture, focus on keeping your muscles relaxed. If you really need to, go to the chiropractor, get a massage, or go to the physical therapist. But that's an easy one to kind of fix. And you probably catch yourself doing one of these things.
Sure.
You probably know it's time.
Okay. What about you're in the throes of a really challenging migraine and you just feel awful, awful, awful? What are some things you can do kind of in the moment to alleviate some of that suffering?
Migraines are tough. So once you are in the throes of a migraine, you just got to deal with it.
Right.
And so there are medications like Excedrin migraine that have caffeine and aspirin and other things like that are known combos of drugs that can help. But a lot of times it's like put an eye mask on, put in earplugs, go lay down, wait for it to pass. But some headaches can turn into a migraine, like a tension headache.
Oh, okay.
First it's stress and then the muscles get tight and then it becomes a tension headache and then it turns into a migraine. If you can stop it before it turns into a migraine, you haven't pulled the trigger.
Okay. Can we do things in our body to just relax in those moments at all?
100%. One of my favorite ones is just a posture relief.
Okay.
Where you bring your shoulders back, you bring your shoulders down, like you're trying to tuck your shoulders into your back pockets. Tall neck, maybe retract the chin a little bit.
Okay.
Holding this for 15 seconds to a minute can be enough to let these ones relax.
Oh, okay.
And sometimes that prevents a headache from even having a chance to start.
How do you know if it's something that's going to become maybe an actual emergency situation where you can't just wait it out, you might need to call for some help?
So in all the textbooks, the in quotes words is, "This is the worst headache of my life." There are ones where it's not like a migraine. This is over the top, scary. if you catch yourself or a loved one saying, this is the worst headache I've ever felt in my life, that might be go to the emergency room situation.
Yeah, I don't want anyone I know to ever experience that. That sounds awful.
No, it's terrifying.
But you'll know.
You know.
You'll know if you're in that situation.
But it's different. It's not the same. It's a different type.
That's a good one to take home with us today. Thank you so much for stopping by. Great information.
Thank you.
Okay, we will have more at-home tips from Dr. Chris. Just head to our website at katu.com and we will link you there. We'll be right back with more Afternoon Live right after this.